I'm going to introduce him briefly. I think everybody knows Dr. Crandall. He's been around here a long time. He's a wonderful general practitioner and knows his stuff. And he was here in at least 2014. I know he was here in 2014. And he talked to us about that dreaded medical problem called Alzheimer's. And I hear something about it almost every day on public radio. Coming to work, I listen to him, and the research is going on, and he can tell you about all of that. But thank you for coming, Dr. Crandall, and tell us about Alzheimer's. Thank you.
Well, the first thing to say, of course, is that it's a common disease. I think probably everybody here has some experience with it. How many people have no experience with a person with Alzheimer's disease? Well, you're lucky. I'm going to start with my own experience. My first experience with it was with my grandmother. My maternal grandparents, my mother's parents, lived with us the last few years of their lives. And my grandmother had a pretty sudden and rapidly worsening Alzheimer's problem. The last few weeks of her life, she couldn't speak.
In case you forget who you are, I'm going to put that right up there. Gotcha, thank you.
She couldn't eat, and she spent most of that time screaming. She was a really wonderful woman, and my mother took great care of her parents. My grandfather was a Nebraska farm boy that went to college, and he's a really good athlete. Had a AAA baseball contract offer out of college, which he turned down. He went to divinity school and went to China as a missionary. And my mother grew up in Shanghai. And my grandmother, we knew her as Abu, and I hope that I have the translation. I think that's grandma. So anyway, my grandfather was a man of faith all his life, and what he told me some years later is he spent that 2 weeks, the last 2 weeks of his wife's, my grandmother's life, praying that she would die. And that's all he had to offer her. Now what's happened? That's 60 some years ago. Now what have we got? What are the changes in those 60 years? Well, thankfully, we've got a whole bunch of medicines to help the psychological problems, the behavior problems, the depression, the anxiety, the psychosis, all of these really difficult things that the Alzheimer's patients have. But we don't have anything still to treat the disease. So in those years, there have been billions of dollars spent in research and still billions of dollars going into research, but we still don't have a way to take care of this disease. So I'm going to give you several points about the disease. Once you come up with symptoms of Alzheimer's disease, there's really no way to turn it around. And in fact, if you looked for signs of it in patients, younger patients, you still don't have any way to prevent the inevitable problems that are going to happen. You can see changes in the brain if you look for them decades before, but there's still no way to change it. What you can do, and unfortunately, well, not unfortunately, but there are some things you can do in your life, and they're the same things that people tell you to do. Eat a good diet, keep your weight down, don't smoke, don't drink alcohol, get a lot of exercise. The same things that people tell you to avoid diabetes and heart disease may have some effect. But you're talking about lifelong habits. Changing your habits once you start having symptoms is not going to help. So I guess the thing the most important thing you can change earlier in your life that's going to help you prevent Alzheimer's disease is not to drink heavily. There's been this little thing, well, one drink helps you. I think that's gone too. So alcohol really is the one thing we know that can help you prevent a lot of diseases, including Alzheimer's disease. Okay, so how do you diagnose this disease? The diagnosis is clinical, and what that means is what the patient looks like, how the patient acts, how the patient thinks. There's no definitive test that you can do to diagnose Alzheimer's disease. So essentially, it's the family who tells you. You can look at the patient, you can examine the patient, you can talk to the patient, but the family's going to be where you get the diagnosis. In other words, if you think your father has Alzheimer's disease, you're probably right. So how many tests can you do? Well, you can do a whole bunch of tests, but mostly they're done to rule out other causes. If you have a very sudden onset, it just takes you a year to go from the first symptoms to really being demented. You need to look for other things, like are you hypothyroid? Do you have HIV? Do you have latent syphilis? Do you have a tumor in your head? But all of these tests that you might do are based at ruling out other causes. Again, there's no definitive test to diagnose Alzheimer's disease. It's all clinical. And if you see a course over several years, there's really not much point in doing any of these tests, although there's certainly physicians that will order these tests. And especially if you want the tests, just to know, then you probably can get somebody to do them, but the insurance companies will probably say, well, an MRI to look for plaques in your brain is going to cost you $4,000, and it doesn't help with the disease, so we're not going to pay for it. You go ahead and pay the $4,000 if you think you want to. And if you chose to go to a researcher, somebody at the university who was doing research in Alzheimer's disease, then doing a test might have something to do with the research. I should say a word about the new kid on this particular block, and that's genetic testing. There are a whole bunch of genes that we can isolate now. And there are a few genes that are associated with the possibility of people that are going to develop Alzheimer's disease. But having that disease or having that gene does by no means mean that you're going to ultimately develop Alzheimer's disease. So there are plenty of elderly people that are normal that have these genes associated with Alzheimer's disease that are still normal. And in fact, if you want to know for sure how good these genetic tests are, I think there are 2 genes now that we know of that predict disease and that we can do something about, and those are the breast cancer genes. So that's it. There's a great future in this, but right now, it's not going to help us with Alzheimer's disease. Okay, so the bottom line is, how do you know that the person has developed to the point of Alzheimer's disease? And I'll tell you a question that I got many times in my career. People would come and say, geez, I can't remember names. If I got Alzheimer's disease. And my response to that was, boy, if forgetting names was a disease, I would have been in the nursing home many years ago. So that's not Alzheimer's disease. So the key word is functional, right? If you're functional, you can get through the day, you can get through the week, and get through the month without any help. You can find your way home, you can balance your checkbook and so on. You're not demented. So the functionality really is the key. And obviously that's the point at which the person is going to need some help to get through the day. So the worry about forgetting names or all of that, keep the functional word in your head. If you're functional, you're not demented. Okay, so who can take care of you once you get Alzheimer's disease? There are, the medicine is changing, but a decent family practitioner, general internist, the new people, the physician assistant, nurse practitioners can take care of you. And I think if you practice in an old county, and we certainly have one, you're going to be pretty good at geriatrics with whatever training you had, just from the experience that you have. But I will say that it's sort of more compartmentalized. If you've got a person who's got behavior issues, which is one of the things with Alzheimer's disease, you really need a psychiatrist to prescribe the drugs. Well, if you think you do, you're going to have to see a psychiatrist. But there are plenty of people like me who were perfectly comfortable in prescribing those drugs. I think there's a new entity that I'm going to suggest to you, and this is, I think it's a national organization that sort of certifies the local organizations, and that's the Center for Healthy Aging. And you can look that up. There's a Center for Healthy Aging in Roanoke. And my advice to the families was go ahead. Because what you want to be sure of as a family that you're doing exactly what you can. Make sure you haven't left anything out. Trying to help your parents with this disease. I never saw any change in what these people were doing that would help them more than I was doing. But I always suggested it just to make sure the families had that exposure, and we're talking to people that did this every day. Okay, at the university, that's another thing I talked about there recently. If you go to the university, you've got a chance of having your Alzheimer's patient put in a study, which I think is worthwhile. Hopefully, all these billions of dollars are going to come up with an answer. And for those of us who are pushing 80, we hope it comes soon. Okay, so how can you treat this disease? There's sort of two classes of drugs, and I'm gonna deal with the most commonly used ones, and those are my basic label for these is behavior drugs. So people get depressed, they get anxious, they can become angry, they can become agitated. So there are a whole bunch of drugs: antidepressant, anti-anxiety drugs, antipsychotic drugs. They're anti-seizure drugs, which are given for help with depression, not with seizures. None of these are really effective drugs. And they all have side effects. I think the one drug that's going to be more and more common as people develop worse and worse symptoms is these are called they're antipsychotic drugs essentially. And if you know people in the nursing home that are really getting demented, a lot of those people are on Seroquel. I don't know if that rings a bell with anybody here, but what you'd like to be able to do with these people is have a one-to-one person, so you can keep the person calmed down. But I know of no way that's going to happen anywhere. So they're these drugs, these anxiolytic drugs like Seroquel, and to back up to what I started this talk with, it would have been really nice if there was some Seroquel for my grandmother. And she was Chinese, Abu. The grandparents were Abu and Granddaddy. Granddaddy and the rest of the family would have liked to have been able to give some Seroquel to Abu. Okay, so now the more specific medications for Alzheimer's disease, there are a handful of them, and if you from time to time, these get heavily advertised on television, so you probably know these names. There's just a handful of them. And the first one was Aricept, and then there was Exelon, and there was a new one is Razidine that's come out since I left practice. And Namenda And that's essentially it. So are these drugs helpful? And the answer is a little bit. I think if you sort of look at the decline of people with Alzheimer's disease and you start these drugs, maybe it's going to level off a little bit for a while, and then it's going to resume at the same level. So essentially what you can do with these drugs is maybe lengthen the period of time before they need to be institutionalized, or before you need to have help in the home. And that's worthwhile. And I'll tell you the way I use these. 2 minutes. I'm going to make it. I must be talking pretty fast here. So these medicines are worthwhile in a limited way. They all have their own side effects. And the way I would use these is to offer them. And you know, the drug companies would give you samples. So you could give a family a month's worth of samples, and then either call them or have them call you or have the patient come back. And would I be looking for a change? The answer is absolutely not. I want to know what the family thinks, right? So if the family says, well, yeah, this helped, fine. If the family says it didn't help, or the patient had a side effect that made them unable to continue, obviously you'd stop it. So I'd say, you know, probably half and half. The families can come back and say, this didn't help. I said, well, there's no point in using it. But then there'd be patients or families that said, sure, this helped. So I had people that continued to say, yeah, this helped. So I had patients that were taking some of these medicines for years. And was I going to tell them that they didn't help? Of course not. So those are medicines that can be used, but they don't really change the course of the disease. They sort of slow it down a little bit. But what I said before, I'm going to repeat: if you manage to keep the patient out of the nursing home for 6 months, is that worthwhile? And the answer is, of course it is. Now, there's one more thing which I'm going to talk about very briefly. And it comes down to the caregiver, and God bless us all. You know, the ideal thing would be, and it's probably more likely in Allegheny County than a lot of other places, but, you know, if you've got a big family and everybody's interested in taking care of the patient, you can split it up evenly, you know, that's ideal. I don't think that happens very often. I think more likely the care falls on one person. Who may not have any help at all. And I've always used this, and I think it's really important. But if you can find one person that's going to give you a day off every once in a while, and not on a moment's notice, but scheduled, so you can look forward to it. I'm going to be off this day, and then you can get your rear end out of the house that day and do something. It's going to be a whole lot easier to take care of this patient. You know, if you have to pay for it, and of course that's hard, but if you could pay somebody because you didn't have a family member that would do it, or that no other family members were there, I think that's just a good suggestion. That idea of scheduling it so you know it's coming is a big deal. So what else? You know, obviously if you have a strong, helpful church, that's maybe better than some of the families. The local office on aging can help. I'm going to give you a number which you can use, and I really didn't know much about this until recently, but it's 211. Do you know this? You know about 211? You can call 211 and talk to a person who can answer questions about your problem. You can say exactly what you want. You know, this is what I need. Where's the help? And this person can help you, can guide you to the resources you need. And what we've done recently, there's been a community health initiative, so-called, through the nurses, the head nurse from Roanoke is what we're just still in the middle of all this. But what we've done is tried to put all of the local things into 211. So if you've got a church that does some things, put that into 211. So write that down. I didn't know about this, but it's really strong, and it's stronger over the last month or so since we've tried to put more people in it. And I'm over by a few minutes. But I'm going to say one thing about being late. And I've got enough patients in this room that know about this. But I'll just put my wife into this. She gets really upset when she has to sit in traffic. And my response to her is, look, if I waited the rest of my life, I wouldn't be able to make up for a tiny fraction of the time that I made people wait to see me. So just cool it. So thank you.